Okay, here is our little brief rundown of genitourinary diseases. Remember that the biota for females, both females and men are going to rely quite heavily on the presence of lactobacillus to maintain like their normal biota. But particularly so in females, the shift in lactobacillus can lead to some pretty bad changes in the biota, causing pathogenesis essentially when the other organisms overgrow. And we'll get into that in a moment, but biota of females changes with hormone changes, like anytime there's hormone changes, whether that is with just menstruation or getting pregnant or menopause or puberty, all of that's going to lead to changes, as well as anytime you have a sexual partner, right? Once you start sexual activity is what I'm trying to say. That's going to introduce you to somebody else's biome and bacteria, and so that's going to change your own. That's the case with men. Men's biome, their biome will change with sexual activity. It also happens to be that uncircumcised men have an inflammatory biota that is due to the foreskin and the environment under the foreskin, and that can make them more susceptible to certain STIs. Urinary tract infections, 80% of them are caused by E. coli. There is a type of E. coli that is more adherent than others, and that is the one that is associated with UTIs. Vaginitis, itis, vagina, right? So inflammation of the vagina. This is going to be yeast infections and trich. So yeast infections are caused by Candida albicans. Remember, that's a fungus. Yeast is a fungus. And then Trichomonas vaginalis. I don't know, it's kind of a boring one, but it is a sexually transmitted infection caused by protozoan. Then we have vaginosis. This is what we call BV typically. So bacterial vaginosis. It's not vaginitis. There is no inflammation of the vagina here. This is usually typically due to a decrease in that lactobacillus population. And I keep feeling like there's a hair right here. In the vagina. Yeah, so anytime that we have a flux, so take an antibiotic, kill off the bacteria, Candida will overgrow. So Candida overgrow. So maybe you take, I don't know, what is it called? Monostat. You do monostat or something like that, and you get rid of the Candida, but now we have a growth of bacteria that are not like necessarily lactobacillus. It's unbalanced, and you can then get BV because of that. And also it can be associated with, it's not like transmitted sexually, but it can be associated with sexual activity and cause shifts in the lactobacillus population. All right, gonorrhea is caused by the gonococcus. That is Neisseria gonorrhoeae. So this is the gonococcus. Remember the meningococcus? Yeah, Neisseria meningitis. So this is related to that same genus. This also is a gram-negative diplococcus, but this is going to be an STI. Chlamydia is caused by Chlamydia trachomatis. This is a bacterium. It is the most common of the reportable STIs. I want to be clear about this. It's the most common of the reportable STIs, the ones that the CDC are actually tracking. There are others that are more common, but they are not tracking them, maybe because they're too common, or maybe because it's just hard to keep track of them. They're underreported and stuff like that. So chlamydia is one that they do track. They do want reported. All right, next was syphilis. Remember the Tuskegee study where we had African-American males who were part of a study where they had syphilis and they were not treated, and they were observed for 40 years. And we were told that they had informed consent, and that is questionable at best. And as far as not treating them when treatment is available, that is questionable at best. So let's not forget that. With syphilis, we have 3 stages. The primary syphilis, we have the canker at the site of entry, with a small, hard, sort of sore wherever the bacteria got in. These guys are spiral shaped, and it can cause a lot of inflammation associated with their entry into the body. So yeah, so you see a lot of inflammation at the site of entry. After that, we have the secondary syphilis. So usually, like in the United States, the canker associated with primary syphilis is so recognizable that most Most of the time it's going to get caught at that point if you were to have it. Secondary syphilis, we don't see a whole lot of in the United States, but secondary syphilis, very characteristic of secondary, is going to be the rash on the palms and the soles of the feet. It's like a reddish rash. You can get it all over. That's not as common, but it's very characteristic to have it on the palms and the soles. You can also have sore throat, lymphadenopathy, and fever associated with this. And then in tertiary syphilis, we have development of gummas, which are just soft tissue. I mean, I don't know what to call it. Soft tissue lumps and whatever, like on the neck and stuff like that. And then we have, I mean, would just be lumps, like soft lumps. And then neurosyphilis, which is going to be associated with dementia and blindness. The most common STI overall, altogether, is HPV. Out of all of sexually active people, 90% of them will have had HPV at some point. That's not a joke. That's a real statistic. 90%. This is the virus that causes genital warts as well as cervical cancer. You may have no symptoms at all. That's probably the most common, actually. This is why we get pap smears. We want to check to be sure that you don't have HPV in your cells. If you do, then they let you know that, and they want you to come more frequently, and they will check for any abnormal growth of your cells and then deal with it as it comes. This is how we can get rid of what was an extremely common cancer and now have knocked it down quite a lot, is via regular pap smears and adherence to doctor recommendations for having your pap smear. So don't miss out on that. Definitely go get your pap smears done. And it's not just associated with cervical cancer. It can be associated with penile cancer and anal cancer and even cancer of the head and other areas as well. And it's not just with genital warts. And you can have you might be thinking like, well, I don't have genital warts. I don't need to go get a pap smear. So whatevs. And I'm going to tell you, the ones that cause cervical cancer really typically aren't the ones that cause warts. They don't overlap very much. There might be a couple strains that do, but for the most part, the ones that cause cervical cancer don't have any symptoms. So how would you know? So go get it done. Better to know than to die. So there is a vaccine available. It used to be just given to adolescents. It turns out that most cases, I want to say it was really high, but I can't remember off the top of my head. Most cases will just say of HPV are contracted in adolescence. So I'm just saying, you might think your kid is the perfect angel that doesn't need to be getting Gardasil vaccines because your kid's not going to be having sex before, 42. And that's great. I'm glad you believe that, but how about just in case? How about just in case? That's what I say. That's my recommendation, and I bet it's your doctor's recommendation too. So yeah. So the vaccine, it is available for adults as well. And if you have had, even if you've had HPV in the past, if you only had like one strain, you can still get the vaccine and it can protect you from others. It protects against 9 strains, the 9 most common ones. So that's a pretty good deal, I feel like. All right, herpes simplex virus. And ending on a good note, herpes is forever. There is no curing herpes. That's serious. I'm being for real. There are medications that help prevent recurring outbreaks and help preventing symptoms, as well as preventing spread of the virus, that work quite well. But the fact of the matter is there's no cure for it. This is why. So first, HSV1 and 2, both of those can cause both oral and genital herpes. Okay. One of them causes one of them causes the other. No, both of them can cause both. Infection with either HSV1 or 2 does not protect against infection with the other. You can have both. These guys go latent in the ganglion. What does that mean? They hide out in your nerves, a lot like I was talking about with the chickenpox. They just go into the nerves and then hang out up in there. And then whenever you get stressed out or something, life changes, whatever, whether it's physically, emotionally, whatever's happening, you get a little stress, the virus comes back out, and we have formation of the vesicles, and they're pretty painful, and they're fluid filled, and that secretions associated with that are what are going to spread the disease to other people. That's what makes it contagious. That's what I'm trying to say. So I think that's pretty much it. I think that's all I have to say. Of course, as you guys are studying, let me know if you need anything, if you need any more quizzes, if you want whatever I can do for you, please just let me know. I'm here to help you guys. You're paying me to do this to help teach you. So please help me make this easier for you guys, and just let me know. So that's that. And it's been a great semester, I'm assuming, in the past. So hopefully in the future, I'm agreeing with this. And yeah, thanks guys.